Hi, my name is Meghan Pecci, and I'm a registered dietitian at Valley Mount Sinai Comprehensive Cancer Care. And today we're going to focus on some common questions that we get from our community in regards to weight management and breast cancer survivorship. What is the connection between weight and breast cancer? So we know that weight does play a role in breast cancer risk and risk of reoccurrence. And the reasoning behind that is because excessive amounts of fat on the body can increase insulin resistance, inflammation, and also increase those estrogen levels, leading to increased risk of hormone-positive breast cancer. When it comes to risks, I like to focus on what is in our control versus what is out of our control. So what is out of our control is genetics. We don't control that, but what we do have in our control is how we can manage our weight. And with that, it's a focus on diet, physical activity, stress management, and getting adequate sleep. Is it true breast cancer treatment makes you gain weight? So certain medications such as endocrine therapy, which is a wide umbrella of different medications such as anastrozole, letrozole, tamoxifen, do tend to lead to some weight gain in some of our patients. Not necessarily guaranteed, but they do find that it's easier to gain, harder to lose. And the reasoning behind that is because with this medication, it reduces the amount of estrogen in the body, which then leads to reducing the amount of muscle mass. And with that leads to the metabolism changing a little bit. The way that we metabolize foods starts to slow down. However, small changes such as improvements in the diet and physical activity can go a long way, and meeting with a registered dietitian can help you with that. Last question. What are the best nutrition and lifestyle approaches to manage weight for breast cancer survivors? So the American Cancer Society does recommend following a Mediterranean plant-based diet focusing on fruits, vegetables, whole grains, protein foods such as poultry, fish, dairy in moderation, and limiting the amount of red meat in the diet. Our team recommends no more than once a week for red meat, and red meat meaning beef, pork, lamb. When it comes to processed meats, which includes foods such as deli meat, sausage, bacon, there's a strong link between processed meats and breast cancer, so we recommend trying to limit that to the best of your ability, knowing that any amount can potentially increase the risk. When it comes to alcohol, we know that there is an increased risk of breast cancer and also the risk of reoccurrence from happening. So our team recommends no more than 3 drinks a week and being mindful of the serving size of each alcoholic beverage. So beer being 12 ounces, wine being 5 ounces, and liquor being 1.5 ounces. Now more than ever, there are a variety of companies coming out with non-alcoholic beers and wines, so maybe that's something that you can check out, in addition to looking into a new mocktail recipe. When it comes to weight management, physical activity is just as important. So focusing on that strength and resistance training is key, especially after menopause, due to that muscle wasting that we do see in our patients. American Cancer Society recommends 150 to 300 minutes of moderate physical activity, which would include a brisk walk or yoga, or 75 to 150 minutes of vigorous physical activity, which would be anything from running to a HIIT workout. The most important thing that I like to focus on with my patients is making sure that they're choosing physical activity that they actually enjoy. When you enjoy the physical activity, that's when you remain consistent. And altogether, when it comes to weight management, consistency is key for diet and physical activity. I hope that you found this information helpful. If you want, you could check us out on Instagram or visit our website for more information.